everybody doing? I believe you are all fine. I welcome you back to my YouTube channel. Remember, it's only here whereby we talk about the kids' welfare, medical problems, and finding solutions. So this is the pediatric world, and here we talk on common illnesses affecting children. So in today's episode, we are going to be talking about low blood sugars in children, and this we call hypoglycemia. I'm sure we mentioned it somewhere. So hypoglycemia is the low blood sugar levels, and it is a killer disease to start with. Low blood sugar levels is a killer disease in children. So we are saying it's called hypoglycemia. So we expect the unit outline, we expect to do the following. We need to do the introduction, the objectives. We want to define what hypoglycemia is, and we have already said. We want to know the clinical signs and symptoms of hypoglycemia. How do these children present? We are going also to treat the hypoglycemia, and we are also going to see the summary of the whole topic on hypoglycemia. So welcome to this episode. So like we said, hypoglycemia is low blood sugar levels, and by definition we say it is blood sugar levels of below than 2.5, and we measure these sugars in form of millimoles per liters. So when you say this child has hypoglycemia, it's after checking the blood sugars and the levels come below 2.5 millimoles per liter. We say this is how we measure. And also we define it is hypoglycemia if there is the blood sugar levels again are below 3 millimoles per liter in the children with severe acute malnutrition. We are going to tackle malnutrition on its own. It's a serious thing. It's very, very dangerous. So we are not going to say that it is in all children that we say hypoglycemia is blood sugar levels of less than 2.5. In all normal children with less than 2.5, that is hypoglycemia. But for those children with severe acute malnutrition, these babies, when their sugar, we say the limit, the sugars should not go below 3 millimoles per liter. So that is the definition of hypoglycemia. We have seen up to what levels we say there is hypoglycemia. How frequent is hypoglycemia? Maybe by knowing the frequency. So among all children admitted, hypoglycemia is in approximately 8% in these children. All babies, all children admitted, 8% of them normally have this hypoglycemia, these low blood sugar levels. Imagine, so it is everywhere. It's something we cannot really escape. And approximately again 20% of sick infants, those below 7 days, have hypoglycemia. So we really need to be very, very careful and very keen, and we should always check these blood sugar levels. So we are saying in approximately 20% of sick infants, those that are below 7 days, they normally have this hypoglycemia. Data also show that approximately 30% in children have hypoglycemia. Those children with other diseases like severe malaria, if these children had a severe malaria, also things like anemia. Anemia is low blood levels in the blood. So if they have anemia, if they have respiratory tract infections, like you see the pneumonias and all that. Children with diarrhea, remember we just talked about diarrheas in children in other episodes. Also again in malnutrition. So we are saying 30% of children with other diseases like we have mentioned, the malnutrition, the diarrheas, the respiratory tract infections, and also severe malaria, 30% of these children are we are going to see that they have hypoglycemia. So it is in all cases. We are saying those normal babies, those below 7 days, and also with other diseases, hypoglycemia is everywhere. So we should be very, very careful. So this then, hypoglycemia then is a common phenomenon. It is a common phenomenon in sick children, and it should be actively looked for and managed appropriately. So that is why we should never ignore, because we are seeing almost all babies, all instances, we are going to have hypoglycemia, the low blood sugar levels, and we are saying this is a killer disease in children. So then, how do we focus? How do we focus or to identify hypoglycemia in children? And now this takes us now to clinical signs and symptoms of hypoglycemia. So how do these babies, how do these children present when they have low blood sugar levels? These are what we are calling clinical signs and symptoms associated with hypoglycemia. So number one, they are going to present with excessive sweating. These children are going to really sweat. They are going to be restless. There is going to be restlessness. These children are going to have irritability. They just cry. So this is irritability. They also have poor feeding, and in small babies they have poor breastfeeding, poor suckling. They are not able to suckle. They are not able to breastfeed well. Also, they are going to present with convulsions. The topic we just from completing the other day, the convulsions in children. So these babies with hypoglycemia we are saying they are going to have again convulsions. They are also going to, in severe cases, they are going to go into coma. Coma is the unconscious state. So they are going to be unconscious. They are not going to be alert. So this is how they present. So you can see they are common presentations. So we might not take them serious. Yet these babies have got these low blood sugar levels in the blood. Well done. So, however, not entirely reliable. Those clinical signs and symptoms, not entirely reliable. We are not going to say, because we have these symptoms we have talked about, then these babies are having hypoglycemia. So the best way of diagnosing hypoglycemia is to measure the blood sugar levels. We just can't leave it at that. We say these symptoms, then this child has hypoglycemia. We need to do blood sugar tests, blood sugar levels, so that we are able to confirm it well. So a point to note, NB, blood glucose should be monitored in all severely ill newborns and children. And this is self-explanatory after what we have just said, that we have said that the prevalence that in sick children, we say that we are going to have hypoglycemia in approximately 20% of the sick babies. So what we are saying is that all sick babies, those babies that are severely ill, the ill newborns and children, we should keep checking the random blood sugar. This is what we usually call the RBS. So the hypoglycemia, it is the low blood sugar levels. So thank you, my people. I believe you know, and we are saying this is a killer disease. So we should be very, very, very careful about it. So we are going to leave it at there, so that in our next episode we continue from here. Thank you for staying tuned, my people. Thank you for listening to me. And if you haven't subscribed, please hit on the subscribe button, the red one, so that you become part of this wonderful family. We want this information to reach as many people as possible. Even the mothers, we want to include everybody into management of these babies. We want to create the awareness, the know-how on what really happens to these children while growing up. So again, turn on your notifications so that you are the first person to know every time I post a new video. Remember to leave a comment down below. Ask any question, any clarification, comment about this video, and I will really appreciate. Thank you so much, my people. Till next time.